Now an update on the latest medical developments related to the pandemic. Here to discuss them once again, CBS News medical contributor Dr. David Agus, who joins us from Los Angeles. Doctor, good morning. 250 million Americans now impacted by these social distancing guidelines. How long will it be before we understand or realize how effective these guidelines have been?
You know, there's a delay. Obviously, there's an incubation period of the virus, 2 to 9 days, and then the virus itself has a course of several weeks. Testing in the United States still isn't where we need to have it in the big cities, and so we look at hospitalization rates, and I think they're going, or they should start to level off over the next week or so in many of the major affected cities now. What we're worried about are the next wave cities that were alluded to earlier in the show. And then again, there'll be a lag between intervention when we all stay inside, social distance, to when we see an effect on the virus.
Doctor, there's been a shift in the guidance on wearing masks, as we've talked about here on this broadcast. What should people know right now about covering their faces in public?
They need to know they have to do it. I mean, this is something that's imperative. When you breathe on a mirror, those are droplets. And if you go outside and you're asymptomatic, and remember, people are asymptomatic before they get symptoms, before the virus, and they're also can be asymptomatic the whole course of the virus. You breathe, those droplets can spread. You wear a homemade mask of cloth, you can stop that and save other people and shorten the duration of the virus in this country. We all have to play our part.
You know, that is one of the ways, Dr. Agus, that you can help prevent the spread. And we're learning that about 25% of the people who are spreading this may be asymptomatic right now that have the coronavirus. How's that affecting how we are approaching, treating, and going after this disease?
Well, I mean, that unfortunately is the difficult part with this virus, is some people have minimal to no symptoms at all, and they're contagious. And when they go out, they don't mean it, because they don't think they're sick, but they go shopping, they stop and talk to somebody, that can spread the virus, and then it keeps spreading. If the virus keeps spreading, our period of being inside will be prolonged. We really all have to work together on this. And I know it seems overkill, but everybody needs to stay inside. And when you do go out for necessities, please wear a mask.
One of the things that we've talked about with you throughout the weeks is the idea of treatments and the approach to this. Technology is playing a role. What can you tell us about where we are in regards to that right now?
Well, yesterday was a big step up. The Secretary of Health and Human Services, Azar, announced that a new database put together by Oracle was launched. And every doctor in the country will register a patient now before starting treatment. And then if the patient's outpatient, he or she will get an email every day and be able to update what's going on with their treatment. So we will know what drugs work well, when to use them, and who to use them in given time. I mean, it's very exciting that we're going to collect data, and every patient will be part of the cure, and we're all going to help together. The data, the website for this is covid19.oracle.com. Every doctor, please go there and register before you put patients on medications, because we have to learn from every experience so we can all get better.
We have to be patient as well, seems to be the lesson for all of us in this. Dr. David Agus, thank you very much.